Alright, so Boris Johnson announced it again. All of England is now in pretty much lockdown 2.0, an official one, 3.0 really. But we're basically back to where we were in last spring, with all of England being in now tier 5. As we all know from yesterday's announcement from Boris Johnson, it is pretty much the same rules as it was in spring. So, you can't go out unless for essentials or for exercise, and so on and so forth. So this is really a scary time for a lot of people. And it's even scarier if you live with someone who is shielding, or you're taking care of someone who is vulnerable. Especially if you're, for example, a medical student or a healthcare professional or a healthcare student, and you still have to go placement or you have to go to work, and then you have to go back home and take care of someone who's vulnerable. We live in a scary and crazy time. And it's even scarier for those people who have this fear in the back of their mind that they could be affecting the people they live with. Then there's a lot of people out here who live alone. For example, medical students or any kind of students that haven't been able to go back home. For example, their parents are abroad or the house is abroad. Or they just missed a deadline for the tier 5 restrictions and they aren't, or for example, they lived in tier 4, they can't move back to their parents' house. And now they're stuck until probably mid-February, maybe even longer, living by themselves, without friends, without family, just in their own house. And to the people who are used to live in a tier 2 or a tier 3 area or a tier 1 area, this is a major change. All leisure facilities, all activities that we love and take for granted have now been closed. And for people who live in tier 4 areas, who have already been exposed to these restrictions, they're only going to last longer now, and they're going to affect them much longer. So really, mental health of this population in England is most likely going to suffer. People are going to be scared, people are going to be alone, people are going to be worried as to when this will all end. And people who've already suffered because of these lockdowns beforehand, it's only going to get worse. So now really is a more important time than ever to not only take care of ourselves, but those around us. And this is why there is a silver lining to all of this. It may be that this is something pretty much tragic. Not only are we facing a problem with the NHS, with it being overwhelmed with patients and many people losing loved ones, but to the people who are not ill with the disease and will have to suffer the consequences of this disease, who will have to live through the problems with it in their mental health, this is still something that we need to take care of. So as I mentioned, there is a silver lining. And it's quite a significant one because we've experienced this twice already. And if you live in tier 4, 3 times already, except this third time is pretty much extended. And people become good at knowing how to tackle problems with their mental health, and so is the government. And they've recognized this and help people cope with this situation. For example, you can still go outside and enjoy the fresh air. I would recommend, this is what I did in the first lockdown. Go on Google Maps and find a weird, wonderful location near you. Maybe a national park. And just, if you've never been to it, go to it. If you have been to it, go to it again. Or if you want to go somewhere else, go explore somewhere else. We are still allowed to travel, to go outside for fresh air and exercise. Preferably, they still want us to stay in a local area where we live. But you can see if you live in, for example, in London, and there aren't many parks around you, you can travel to one that is further away from you by car or by train or by tube or whatever. And even if you live in the countryside, if you find something amazing, go to it, go work out there, go run there. So it's really important to preoccupy yourself, not only by exercise, but by doing stuff that's proactive and productive. Not only does that include work and doing uni work and whatever it takes to succeed, for example, but also leisure. We may be stuck at home, but there's many stuff to do, many DIY projects you can take on, many hobbies you can take on. You can, like I said in my previous hobbies and studying videos, just take on something that is productive and proactive. To preoccupy yourself and make sure that you are engaging with your mind and taking care of your mental health. Heck, you could even be cooking for yourself wonderful dishes that you've never tried before. Get a cookbook or check out more YouTube videos by me, Abdullah Dawood, Medicinals. One thing that I find quite amazing and quite important for people to use, especially if they live alone, is support bubbles. I'm not sure if this was in the first lockdown, because I remember, it was a complete stay at home order. No meeting with anyone outside. But I think the government has realized that this is not very good for people's mental health. And people, for example, who live alone or just live alone with their children are now allowed to go hang out with another family or their support bubble. And this is something that is extremely important, extremely helpful in these kind of circumstances. Because you actually get to interact with people in real life. And we are social beings, we are social animals. So this is a very important thing to take into consideration if you live alone or live alone with children and if you've never tried before. And now this is a more important time than ever to check up on your family and friends. And now this is a more important time than ever to take care of your friends and family, to check up on them, to talk to them, to call them. We've been through almost a year of this, of these lockdowns and this coronavirus and these restrictions and this uncertainty. So it's more important than ever to get into contact with your friends and family, to call them, ask them how they're doing, ask them what they've been doing for the day. Just engage with them. We may not be there with them, but we still have relationships with them. And if you are finding it a struggle to talk to people, you have no one to talk to, or you don't want to contact your friends or family because you're worried about how they will feel about how you're feeling, there's still help out there available for you. England had this wonderful society, this wonderful charity called Samaritans. There are people who you can just call and talk with regarding how you feel. They will listen, they will counsel you, they will be there for you in your lowest times, and they will take care of you. And now this is one of the most important times for people to feel as if they are burdened and I feel as if their mental health is going down and they have no one to talk to these professionals who can help them. And we all have to keep into consideration that this will eventually end. We have the vaccine, and people are already studying if the vaccine will work on the new strains, and so far they are finding that it does kind of work. And so we have quite a lot of hope for this vaccine, for all the variety of vaccines that have been produced. And hopefully this will end much faster than it has started. And hopefully 2021 will be our wonderful year. So I really hope you enjoyed this episode of Medicinals. And I really hope that you take care of your mental health during these weird and scary times. And I'll see you all in the next chapter.